Namaste. I am Dr. Dinesh Gupta. I am a homeopathic physician and I will be speaking about the art and science of homeopathy. Homeopathy, it seems, everybody feels that they know homeopathy and they consider homeopathy for granted. Homeopathic science, homeopathy basically is a medical science and you should study it as medicine. It is a very difficult science, but then also everybody is doing homeopathy. Why does this thing happen? Homeopathy is supposed to be a super science. But why? What is the reason that, it is considered as a witchcraft? What is the reason that homeopathy is not accepted as a medical science? So people who are learning or people who are doing or people who are practicing homeopathy, I have categorized people who are practicing or doing homeopathy into three categories. Maximum of the people doing homeopathy, practicing homeopathy or learning homeopathy or teaching homeopathy falls, maximum 70 to 80% of the people fall in the category of curiosity. Curious. Maximum of the people who talk about homeopathy, they have a curiosity. What is curiosity? These are the people who talk and teach about homeopathy, or they feel that they know homeopathy. These curious people, they are looking for some sensation. These are the people who do homeopathy as an amusement, a fantasy. Curiosity, it doesn't have any stake. There is no stake. When a person is curious, there is no stake. There is no risk. It is like that, you ask a question, why the trees are green, and after some time, you forget about it. You have asked a question, why the trees are green, somebody answers it or somebody doesn't answer it. No matter what it is, you pass it on. You just ask a question. Curiosity is like, having fun. Homeopathy as a hobby. Experimenting unnecessarily. No risk. If the patient is, whatever the case may be, first of all, these curious people, they never see any case in their lifetime. They don't know what is disease. Homeopathy is a time pass for these curious people. These are the people who are not qualified. They don't know anything about the physiology, the anatomy, nothing. They don't know anything about the human body. And they are practicing what? Homeopathy. 70 to 80% of people who talk about homeopathy, it is just out of curiosity. As I told you, there is no stake, there is no risk, there is no responsibility. If, first of all, it is for fun, so there is no responsibility, nothing. Curiosity is like an itch, You find pleasure after itching and the itching goes away. So it is what? Deriving pleasure. people want to remain occupied. Okay, so what they will do? They will practice homeopathy. This is the curiosity thing is such that a person will come in contact with homeopathy. He will read a book and then he will refer to his friends. You read this, it is very good. And they go on practicing, they go on doing all the nonsense things. So this is how the first reason for homeopathy not accepted as a medical science is because of what? Curiosity. Curiosity doesn't require any type of intelligence. It is not intellectual. Even idiots are curious. In fact, only idiots are curious. So, maximum of the people who are doing homeopathy, it is just what? Curiosity. I'll give you an example. I'll tell you about a story. There was an innkeeper and no customers were coming to him. So he consulted a very wise person about his problem, and the person told him, it's not a big problem. What you do? You just change the name of your inn, or you change the name of your motel and change the name to 8 bells. And on the board, on the front, you do one thing, you tie 7 bells over there. The name should be 8 bells and you tie 7 bells in front. Now what happened? People used to pass from there, and after seeing the name as 8 bells and only 7 bells hanging, they went inside. Some went inside just to point what? The mistake. Many of them went inside out of their curiosity. They went inside, and naturally once you go inside, you are trapped. So this is how it happens. It was all about what? Curiosity. Some people thought they were very much smart and they went to tell the owner that you have made a mistake. This is how his business flourished. So this is what? Curiosity. Curiosity is, like reading the newspaper. You read the newspaper and you throw it away. So what I mean to say, the practice of homeopathy just for curiosity is not homeopathy. Homeopathy is a medical science. You can do amazing things if you study homeopathy as a medical science. If you are a physician, if you are a doctor, then only you study homeopathy. And study homeopathy from physicians. When you talk homeopathy, talk as a doctor. As I told you, people who are not qualified, when they don't know anything about the body, and those people who are practicing homeopathy, these are the people, who have made homeopathy into a witchcraft. So that was about the first category, the curious people, the curiosity. The second category of homeopaths are the students. The students, these are the intellectuals. These people are after knowledge. They are gathering knowledge. They are collecting information. These people They are like computer. They can only gather what? Information. But there is no transformation. They don't have the capacity to handle real diseases. I will come to it. These are the people who just go on, talking. They go on writing books. In homeopathy, people who haven't practiced in their lifetime, they are compiling the repertory. They are changing the repertory. They are changing the rubrics. They are writing books. These are the people who don't have any experiences of disease. It is all indisposition they will talk about. They will write books without any experience. So these come into the category of what? Students. They go on bragging about homeopathy. But in actual practice, they are unable to present the cases. These are the people, as I told you, they present homeopathy. Here also, there is no that much of risk involved. Only bragging is there. These are the liars. They go on lying about homeopathy. They go on speaking about homeopathy which they haven't seen. A person like Hahnemann, who gives 48 years of his life to write the organon, Hahnemann is working. He first works and then he comes out to the principles. He is first working. Hahnemann gave 48 years of his life to homeopathy. These people, in their lifetime, they haven't seen any principle of homeopathy. They cannot demonstrate the killer aggravation. They cannot demonstrate the reversal of symptoms. These are the people who talk, teach and practice homeopathy hypothetically and theoretically. Homeopathy is a medical science. Whatever you are talking of homeopathy, you should be able to demonstrate those things on patients. Homeopathy is the only medical science in which people learn homeopathy through photos. And if you point them, if you tell them, they become very much offended. There are people who write books on gynec and ops in homeopathy, and most of them are not even doctors also. You are writing books on gynec and ops, you haven't delivered a single child. You haven't followed through the 9 months of pregnancy. What are the problems there in pregnancy? But then also they write books on gynec and ops by a homeopath. Ops also. How many cases, when you point these things to these people, they become very much offended. If I am a homeopath and if I tell them, if a person is, suppose he has written a book on gynec and ops, or if a person is talking about what? Febrile convulsions, management of febrile convulsions by homeopathy. I am a homeopath and I know how much difficult it is to manage febrile convulsions with homeopathy, though I manage very serious cases. So if I ask this person, sir, would you please tell me how many cases have you managed? Instead of telling me, instead of showing me example, he gets offended. These students of homeopathy, in their lifetime, they haven't seen a disease. These cases, they cannot show you casualties in homeopathy. These are the people, the students of homeopathy, These are the people, in their entire life they practice medicine. Homeopathic is a medical science. And in their entire life, nobody has died. He is a doctor. How the person will die? When you will manage cases of that level, then you get casualties. These are the people who just go on talking. These are the shrewd people, the cunning people. These are the businessmen, the pharmacist. These are the people, who will teach homeopathy like polypharmacy. They will mix homeopathy along with Bach flower remedies. They will mix homeopathy with what? Biochemic remedies. Bach flower remedies is not homeopathy. Biochemic remedies is not homeopathy. So, the category of students, it is all what I can say, a type of, you are using your intellectual, you are fooling people. These are the people who give you lectures. The entire young generation are destroyed by these people, the legendary people. They will show photo of, facial paralysis, the 7th cranial nerve paralysis. They will show photo. Why are you showing photos? You are practicing since 30 years, 40 years. Show me a case. Nowadays it is so much easy. The digital technology. You just have to take the photo and show me. You have to take the video and show me. Those cases, these are the people who boast about homeopathy in self-limiting diseases. The person gets cured after a certain time. There are diseases like, chicken pox. If a person is having chicken pox, maximum of them might not have seen only chicken pox. I will show you a case. They cannot diagnose simple case of chicken pox. They cannot diagnose simple case of viral hepatitis. These people, suppose they are having a case of chicken pox. Chicken pox, it will run its own course and it will go away. You give the person medicine or you don't give the person medicine, he will recover. The mortality rate is far less. Viral hepatitis, 10% of mortality rate. And maximum, if a person is suffering from viral hepatitis, 10 people out of 100 people die. 90 people, they recover. The time period is 3 weeks. There are stages. In these 3 weeks, the person will have vomiting, fever. In the second week, in the first week he will have nausea. There will be mild discoloration. In the second week, the person will develop what? Vomiting, jaundice, yellowish color, Coca-Cola color like what? Urine. And third week, all the symptoms will start reducing. And within a month, what will happen? The person will recover. Now, if you are curing this person in 1 month, homeopathy is not doing anything in that. So these people, they what? They talk, they distort homeopathy for their own benefit. These are the people, who are businessmen. They do business. As I told you, they are intellectuals. They write books. It is because of this reason, they write books on materia medica. Every 5 years, 10 years, they bring about something shit in the homeopathic faculty. Somebody will come with periodic table. Somebody will come with grouping. And what not. They haven't seen any case. Everything should be supported by what cases. Some of them, they talk about what? Lizard and zebra in homeopathy. I mean, this is what jokes of homeopathy. You become the other faculty, the other sciences, medical science like Ayurveda, like allopathic people, they laugh at you because you talk nonsense. These are the people, I don't know from where. Our Materia Medica, the full form, Materia Medica Pura. It cannot be changed. Those provings are brought about by what? Hundred of years of practice. Pure Materia Medica. You have to study the Materia Medica as it is. You cannot, where is the application? Modern people who are writing, about homeopathy, as I told you, it is what? Like a sensation, something thrilling. Write all those nonsense. People in homeopathic college, I tell you always, they don't practice homeopathy. The teachers who are teaching homeopathy, maximum of them, they don't practice, they don't know anything about homeopathy and they are teaching. And the students, they don't understand anything. And when you are in college, romance is more important than homeopathy. So who studies the organon? Who studies the Materia Medica? After you come out of the college, you are just blank. Now what to do? I have to earn money. Then comes the play of what? The legendary, the 5-star homeopaths. Now these people, just by gathering crowd, it is all marketing stunt. These are the people, they don't know anything about homeopathy. And the students sitting over there, desperate to learn something. They learn all the wrong things. They don't have any common sense also that a person who is teaching you case, how many cases has he presented? All homeopaths, they write research center. They get offended if I ask them, do you know the meaning of research? Do you know how many types of research are there? Your researches are not given any importance because you don't know the meaning only of research. Go and read about research. How many types of research is there? What type of research are you doing? You cannot, one or two cases or one or two things, that will not make you do research. That is why around the world, your researches and your words are not given any importance. So maximum of the territory, they are just creating an illusion of homeopathy. These are the people who will mostly present cases which are functional. A person having pain here, a person having pain here, a person is working, has worked very much, he develops pain in the extremities. And you prescribe rust drops and you say you have cured a case of rheumatism. Have you ever seen a person of rheumatism? Homeopathic people, they are learning what these students, they are learning. Homeopathy is a medical science. They learn all the subjects and then after coming out of college, they learn homeopathy from people who are not having any knowledge of what? Medicine. They learn homeopathy from foreign people. Indians learning homeopathy from foreigners who are called as what? A naturopath. Do you know there are some states, if you are a naturopath or a homeopath, there are some states in the world, if you just see the X-ray, you can be sued. The person can sue you. Just if you look at the X-ray, forget about telling what is there in the X-rays. So you learn homeopathy from these people who just talk about the philosophy of homeopathy, hypothetical and theoretical. They write materia medica, hypothetical and theoretical. What has been given in the classics, you haven't read any time in your lifetime. So I can talk a lot about this second category, the students. The third category is what? The disciple of homeopathy. Category is what? The disciple. Very, very few, negligible. The disciple, the word disciple comes from what? Discipline. Homeopathy is a science of discipline. There is laws, there are regulations in homeopathy. If you become a disciple, then you see casualties in homeopathy. Then people die in your hands. Those are the cases managed by the disciple. Homeopaths nowadays, they are teaching the repertory. Nowhere in the organon is given anything about the repertory. Everybody teaches the repertory. That is not the way to practice homeopathy. You should know your materia medica. So, if you become a disciple of homeopathy, this category, as I told you, it is negligible. These are the people who manage the real cases. If you become a disciple, then you will know how much difficult the homeopathic science is. If you are working on cases as a disciple, like you are managing terminal cases, like you are managing what? Third or fourth stage of cancer. You are managing cases, very serious cases with homeopathy. Then the life of the disciple is very much stressful. You will lose your sleep. You become the physician. Up till this level, curiosity, forget about it. Student level, students, homeopathy, they say, in homeopathy, nobody disturbs you at night. Nobody gets cured, and you can go on milking the patient. So there is what? Allopathic, if you are an allopathic doctor, you get emergencies. Homeopaths, they don't get emergencies. So no disturbance at night. Patients come to you for years, go on milking. These are the patients. Basically, these type of patients, they don't suffer from anything. As I told you, there is no risk. Nobody gets died. But if you get disciplined and if you study homeopathy as a medical science, then life becomes very much horrible. When you take challenging cases, when life is at stake, the relatives are standing on your head, the patient is unconscious or the patient is becoming serious day by day. Okay, then what happens when you go near the patient, you sweat. The sweat from the head goes in the buttocks. Okay, your heart races. There is adrenaline rush. You cannot sleep. That is homeopathy. Then you become what? A homeopathic physician. Anything lingering, going on, all nonsense. They come out of the college, they haven't seen any patients, and everybody is teaching homeopathy. There are less learners, and most of them are teachers in homeopathy. Everybody is teaching homeopathy. They teach homeopathy theoretically, without presenting cases. What you have to do, it's a simple thing. A medical science has to be learned on what? Patients. You don't have to present cases, I'll give you an example. The students category, long back, 20-25 years ago when I was in college, there was a seminar. And a person was presenting cases. He was telling, he presented a case of nitric acid wherein he gave all the symptoms of nitric acid. The patient's urine was offensive like horse. He told like that, I asked him, how do you know that the patient's urine is offensive as horse's urine? See, you just make a sentence out of it, but just think about it. The patient should know how is the smell of the horse's urine. Have you seen in a city like, in Indian cities, like Mumbai, how many people have been near a horse and know the nature of the offensiveness of the horse's urine? So, when you say such nonsense things, it simply means what? You are faking the case. The doctor should know how is the smell of the horse urine. The patient should know. I asked him, did the horse come to your clinic or you went to the stable? So there are many incidences. If you don't know medical science, in India, when a person is dying, they give him water. A person is what? Unconscious. And all the relatives and everybody, they go on putting what? Water in his mouth. And the water slides down also. Now these morons, doctors or anybody, these morons, they don't know that the water is going in the lungs. A person who has to die in 7 days, he dies in 7 hours. So this is what? The level of the knowledge of homeopaths and homeopathic doctors. So many cases I have seen a person suffering from what? An heart attack. Heart attacks mimic as what? Asthma. And they are treating what? Considering it as what? Asthma. So there are so many things. You show before and after. I don't want. If you are teaching homeopathy, you present the case. How did the patient come to you? What is the patient talking? Whatever language it is there, no problem. It can be translated. I just want a proof of the case. How do you get the mental symptoms? They are teaching what? Repertory. Has any patient, they will take what? One word, abandon. And they will discuss the word abandon in repertory. What is there to teach in the repertory? Are you learning what? You learn the meaning of abandon? You are learning medical science or you are learning literature? In my 25 years of practice, no patient has come to me and told me, doctor, I feel abandoned, give me some remedy. Patients come to you with what? Physical complaints. So you show me that. People haven't seen what? They talk about mental symptoms. Everything is mental symptoms. People who go on explaining and teaching mental symptoms, let me tell them, you haven't seen a case in your lifetime. Have you seen a cancer patient? Have you seen a patient who is having very severe pain? Do you think those people give you what? Mental symptoms? You haven't seen a case. That is why you go on talking all nonsense. Go near the patient who is suffering from cancer and just see how much anxiety, how much depressed the person is. He only talks about his pain. The pains are so much severe. And you talk about what? Mental symptoms. Abandon. Fear of darkness. These things you don't get these things in real patients. Real diseases, I will come to that, when I will classify diseases, I will come to it. And then you judge yourself what you have done in your lifetime. Especially homeopaths who are teaching homeopathy to others. They themselves don't know about homeopathy. They cannot present any real cases. They cannot give you the follow-up. You don't know to take the case only. And you talk about what? Homeopathy. Homeopathy is a very, very difficult science. If you happen to take it seriously. So, my intention is to make disciples of homeopathy. People who want to get stressed, people who want to consider homeopathy as a medical science. I will be demonstrating the killer aggravations. There are morons who don't know about homeopathy and they laugh. One moron says, he laughs and says, if a person is suffering from psoriasis, will the person die if I give him homeopathic remedies? Now this moron doesn't know the meaning of gross pathological changes. Psoriasis is not a gross pathological change. Gross pathological change means what? There is abscess in the lungs. There is abscess in the liver. The kidney is damaged. In such cases, if you give the similimum, the body tries to eject all the things which is, suppose there is a pus in the lungs, and you give the similimum to this person, what will happen? The similimum will create a stir in his body, and what will happen? The body will start throwing the pus outside. These people go in what? Killer aggravations. But you will get the killer aggravations when you happen to handle such cases. I will demonstrate the killer aggravation. If you are learning, there are conditions in homeopathy where there is prolonged aggravation. There is reversal of symptoms. Why do you just go on talking about what? The repertory? If you repertorize a case and give the remedy, everything becomes alright. After the prescription, you will get what? The follow-up. Show me the follow-up. I will teach you the homeopathy where every step of homeopathy I will show you on patients, on cases. Video cases, wherein the patient is coming to you. What the patient is telling. And then you show me how you get the mental symptoms. You get mental symptoms in people who don't have any problem only. They have lots of time. A real serious case, you go near the patient, you will try to do everything as soon as possible and run away from that patient. He is so much suffering. His relatives are surrounding him and they are looking at you. What are you going to do? And you talk about mental symptoms. So stop. Homeopathy is a very great science. You can do the impossible with homeopathy. But that requires very much hard work. You need to become a disciple. Follow the discipline. And then you will understand homeopathy as a medical science. People who are presenting cases in homeopathy, first they should discuss, does this person requires medicine or not? So there are lots and lots of things to talk about. These things. I will be teaching the organon. I will be teaching the materia medica. And I will be teaching how to apply the laws of organon and the materia medica to cure the patient. Everything will be on patients. People, I have taken classes earlier also, and I was presenting cases, but now I will take live classes and I will give you live cases. You have to work on the cases. People who feel offended by the right things, people who have got inferiority complex, please do not join my case. People who don't want to participate, I will give you the entire case in the recording form, and you have to work out the cases. First I will take the lecture, and then I am giving you an example. I will be teaching the entire organon, everything on patients, and I will be giving you homeworks also. I don't want to waste my time on people who are just curious or students. If you have the capacity to become disciple of homeopathy, then only you join my case. As simple as that. Cases will be given and you have to work out. First, while teaching, I will teach about the acute diseases. I will give you hundreds of cases of acute diseases, simple cases. If I feel you can handle these simple cases without my help, then I will give you cases, terminal cases, people who are about to die. Then I will give you those cases to manage. And if I feel that if you have the caliber to manage those cases, then I will start teaching you about what? The chronic disease. Herein, I will give you cases of cancers, various types of cancers, various types of incurable skin diseases. And then you have to solve. First, the acute diseases should be mastered. You should know what to see in the patient. You see all those things in real patients. Real cases of fever, 103, 104, fever since 7 days, fever since 15 days, patient having vomiting, patient having severe pain. Those cases I am going to present. Not theoretical cases, a patient of fever came to me and I gave this, I repertorized, this was the rubrics. They are all nonsense. So, if you want to become disciple of homeopathy, then only you should join my courses. Please be prepared. This time I am not going to just present the cases and people learning in their mind. No. It will be a live classes on my app, and you need to discuss. If you are eager to learn homeopathy in this way, if you don't feel offended, okay, in the last batch, on asking a question to a lady, she got offended. These are the people who don't understand anything about homeopathy. So if you are having that nature, I don't have any personal problem with you. I am very much passionate about homeopathy. I am very much passionate about what? Homeopathy as a medical science. I want to make people as homeopathic doctors, not as homeopathic naturopath. Physicians, when you go, a homeopath, when he is discussing with another homeopath, he will fight like a bull. But when a homeopath will tell that this is wrong, they will jump on you. They will become personal with you. And when an allopathic person says you are bullshit, then they will become like this. Then they will become defensive. Then they don't have anything to say. They can only argue and jump on people what? With other homeopaths. So learn homeopathy as a medical science. Thank you.